my name is Hope Kelly. I'm the student nurse today, and I'm going to be performing a head-to-toe assessment on my patient. I am going to enter the room and perform hand hygiene and don some gloves, and I will have the patient verify their name and date of birth with me and check their patient ID as well. And then I'm going to ask them some orientation type questions and ask them what the date is, how they got here, if they know where they're at, who the president is to make sure they're oriented. And then I will begin my vitals. So first I'm going to, I'll start with the blood pressure. I'm going to listen to the respirations. I'm going to write that down and then I'll check their heart rate, their apical pulse. And then I will also check the O2 stat and their temperature as well, either orally or tympanic or under the armpit. And then I will begin my assessment after I'm done with the vitals. I'm going to start head to toe. So I will check their hair, make sure there's a shiny luster and it's distributed evenly. There's no dry patches. And then I'm going to check their eyes, make sure there's no drainage, no pain. Make sure everything, facial features are all symmetrical. I will check the ears to make sure there's no breakdown, and the back of the head to make sure that there is no breakdown as well. And then check the nose, make sure there's no drainage. Have them smile real big for me and check the teeth, make sure that everything's intact. Their gums are pink and moist, and then make sure the trachea is midline, everything looks fine. And then I will start listening to their lung sounds under their gown. So I'm going to listen to the front lung sounds in all the locations in both lobes, and then I'm going to roll them over and listen to the back. And having them take big deep breaths as I'm doing so. Making sure they're still kind of covered. Then I'm going to have them roll over. I'm going to listen to the lung sounds on the back. Make sure I listen to the right and left lobes. And then after that, I'm going to make sure, while they have them turned over, I'm going to check the skin breakdown, see if there is any, make sure their skin is all intact, and make sure they're not moist as well. And then I am, for my patient, I'm going to keep making my way down, checking to make sure the bony areas are not broken down. I'm going to check their bilateral radial pulses. Make sure those are intact. I'll check the skin tuber, make sure there's no tinting, and then I'll check the capillary refill on both sides as well. And then I will make my way down. Keep my patient covered up as well. And I'm going to also check the abdomen and keep them covered up. I'm going to check the bowel sounds in all 4 quadrants first. Checking this under their gown as well. And then I will palpate it to make sure it's non-tender or distended. Make sure it's just soft. Make sure there's no pain. And my patient has a catheter, an indwelling catheter in. So I'm going to check to make sure there's no skin breakdown where the catheter's at, and check the peritoneal area. Make sure everything's all clean. Make sure the catheter is intact, and make sure the skin is not breaking down in the leg where it is taped on. And then I'm going to work my way down, check if there's any edema in the legs, check if their circulation is all right, make sure they have capillary refill in both feet, check the skin tuber there as well, and make sure there's no skin breakdown on the back of the heels. And then I'm done with my assessment, and I will be performing hand hygiene, lowering the bed, making sure that the call light is in place, and if they need me. Also, I'm going to check the intake and output on the Foley catheter as well, and check all the characteristics with that before I go.